Okay, picture this. You're giving your dog a good belly rub,
Yeah.
or maybe scratching your cat's favorite spot, and then you feel it.
Uh-huh.
Something's not quite right. Maybe a strange lump, a sore spot, could be firm, or maybe a bit squishy, just under the skin.
Yeah.
What is that?
Yeah.
That moment, finding an unexpected change, that's exactly where our deep dive begins today.
It's such a classic starting point for, well, a bit of a medical mystery, isn't it?
Totally.
Because that layer of fat just below the skin, the subcutaneous tissue, it might seem simple, but it can hide a surprising number of complex issues.
Absolutely. And that's our mission today. We're
Huh.
taking a deep dive, guided by this fantastic stack of source materials you've shared with us, into inflammation of that specific tissue, the
Hmm.
subcutaneous fat.
Hmm.
The sources are focusing on two key conditions related to this, panniculitis and steatitis.
Right.
Our goal is to unpack what these conditions are, explore the incredibly wide and frankly often surprising range of things that can cause them,
Yeah, the causes are really something.
and walk through the detective work vets do to figure out what's going on and how to treat it. We're going straight into the source material here to get to the most important insights.
Think of it like solving a puzzle where the clues are buried just beneath the skin. It requires some digging.
Let's unpack this then.
Yeah.
At its core, what exactly are panniculitis and steatitis?
So the sources define them pretty clearly as inflammation of the subcutaneous fat tissue. Simple definition, complex reality.
Right.
While it affects that fat layer, the primary systems involved are really the skin and the surrounding connective tissues. Think of it as a problem in that cushioning layer right under the fur.
Got it. And do these conditions pop up equally in all animals? Or are there certain species or, ages that are more susceptible?
Ah, that's one of the first distinctions the sources make, and it's important. Steatitis is seen predominantly in cats.
Most of the cats. Okay.
It can show up in dogs, but the sources say it's often when they're already dealing with other health problems, concurrent diseases. Panniculitis, on the other hand, seems less picky about age. It can affect animals from young pups and kittens right through to older pets.
So any age for panniculitis.
Yeah. Although, interestingly, the sources note steatitis tends to occur in young to middle-aged cats, while if dogs do get it, they're usually older dogs.
Huh. Okay, so besides feeling that lump, what are the other signs you might actually notice?
Well, what's highlighted in the sources is that these aren't, the most common conditions vets see every day.
Right.
But when they do appear, the signs are quite distinct. You'll typically see one or maybe more lumps, what vets call subcutaneous nodules, or sometimes even open sores that are draining.
Draining, okay.
And these spots are often painful to the touch. That's a key feature. And they can feel really different. Sometimes they feel soft and like they might have fluid inside.
Fluctuant.
Exactly, fluctuant. And other times they're quite hard and firm.
And what kind of size are we talking about? Tiny?
Oh.
Big?
They can vary quite a bit. The sources say from tiny ones just a few millimeters across up to lumps several centimeters in diameter, so quite a range.
Wow.
The sources also mention something pretty serious. The fat tissue in these areas can actually undergo necrosis.
Necrosis.
Yeah.
That means it dies off, right?
Yes, the tissue dies, which obviously isn't good.
No. And if there's a draining sore, what's actually coming out? Is it like pus?
The sources describe the discharge, the exudate, as typically a small amount, often with an oily look to it.
Oily, okay.
Yeah, because it's coming from inflamed fat tissue. The color can range from a yellow-brown all the way to bloody.
Gotcha. What if the animal has lots of these lugs or draining spots? Does that change the picture significantly?
Yes, and this is where it gets really interesting, and it points to a crucial insight from the sources. When there are many lesions, especially in dogs and cats,
Multiple spots, right.
right, it's common to see systemic signs. This means the animal is sick overall, not just, locally at the skin.
Ah, so it affects the whole body.
Exactly. They might stop eating anorexia, they might have a fever, pyrexia, be really tired, lethargic, or seem generally depressed.
Wow.
This tells you that the inflammation isn't always just confined to one spot. It can be part of a much larger issue affecting the whole body.
That really underscores why just, treating a lump isn't enough. You absolutely need to know the underlying cause.
Precisely.
And speaking of causes, the source material makes it incredibly clear that the diversity of what can trigger this fat inflammation is a major takeaway. And maybe why this detective work is so challenging.
That's the absolute core puzzle here. A single symptom, that lump, can stem from such a wide variety of origins. It's kind of amazing, really. Let's break down the categories the sources provide.
Okay, let's categorize them based on the source material. What's on the list of suspects? Hit me.
All right, first up are infectious causes. This is where actual pathogens, bugs are involved.
Like bacteria and fungi.
Exactly. The sources list bacteria, fungi, including more widespread deep infections or even certain types of dermatophytes, like ringworm getting deeper.
Wow.
Specific types of bacteria, like opportunistic mycobacteria and nocardia, and even viruses. So yeah, bugs setting up shop in the fat.
Got it. Infectious. What else?
Then you have immune-mediated conditions. This is fascinating because it's when the body's own immune system mistakenly targets the fat tissue.
The body attacking itself.
Essentially, yes. Examples from the sources include conditions like lupus panniculitis.
Lupus can do this.
Apparently so.
Yeah.
Also, erythema nodosum, types of vasculitis, that's inflammation of blood vessels within the fat, or even a reaction to a specific medication triggering the immune system.
Okay, so immune system gone wrong.
Next are idiopathic causes. This is the medical term for we really don't know the exact cause.
Ah, the mystery box category.
Mm.
Always a bit frustrating.
It is. The sources include things like sterile nodular panniculitis inflammation without infection or obvious trigger, or sometimes it's linked to blood clots, thromboembolism.
Okay. What else rounds out this very long list?
We have straightforward trauma, just a physical injury to the area damaging the fat.
Makes sense.
Then neoplastic causes, meaning cancer.
Cancer can cause this too.
Yes. The sources mention possibilities like certain types of cancer spreading to the skin and fat, like multicentric mast cell tumors or cutaneous lymphoma.
Okay.
Or, and this is really surprising, cancers originating elsewhere, like pancreatic carcinoma, that can somehow manifest with this fat inflammation.
Wait, pancreatic cancer showing up as a lump under the skin. That's one of those unexpected connections the sources really highlight.
It is. It shows it's not always just a local skin issue. It can be a distant symptom of something else entirely.
Mind blown. Okay, keep going.
Also on the list are foreign bodies. Think about something like a splinter or maybe a migrating grass seed getting lodged under the skin and causing inflammation.
Right, like a grass on. Happens all the time.
Exactly. And importantly, post-injection reactions. The sources are clear that injections given subcutaneously, like certain steroids, vaccines, or other medications, can occasionally trigger localized inflammation in the fat right at the injection site.
That's a really critical insight. Sometimes something necessary, like a vaccine, can unfortunately cause this kind of reaction.
It's a known potential complication, though usually minor and resolves. And finally, the sources emphasize a specific nutritional cause, particularly for steatitis in cats.
Ah, yes, you mentioned cats and steatitis earlier.
Right. It's a deficiency in vitamin E. This is often linked, according to the sources, to diets high in oily fish, which can deplete vitamin E if it's not properly supplemented.
Vitamin E deficiency from a fish-heavy diet causing this specific inflammation. Another really specific and kind of surprising connection from the sources.
It really is.
Okay, wow. Such a huge list of potential suspects: infections, immune issues, trauma, cancer, foreign objects, injections, nutrition. How does a vet or anyone following this even begin to narrow it down? How do you figure out the actual cause? What's the diagnostic journey look like based on the sources?
It's definitely a process of elimination and evidence gathering. It's classic detective work, really.
Okay.
The first step, as the sources lay out, is building a differential diagnosis list. Basically, what are all the conditions that could look like this lump or sore?
A list of suspects.
Exactly. And the sources point out that infectious causes are actually more commonly diagnosed than the sterile or immune-mediated forms of panniculitis. So infection is often high on the list.
Good to know. So what are some of the key lookalikes that need to be considered and ruled out first?
The sources list several important ones. Deep pyoderma, which is a serious bacterial infection deeper in the skin layers, not just the fat.
Okay.
In cats, oddly enough, FIP, feline infectious peritonitis, can sometimes present with similar skin signs.
FIP? Really?
Yeah, another systemic disease link. Then there are things that might feel like lumps but are different structurally. Cutaneous cysts. These are usually smooth, not painful or inflamed, and you can often feel distinct edges.
Different feel.
Right. And lipomas, which are benign fatty tumors. These are typically soft, movable, well-demarcated, and don't usually cause inflammation or draining tracts, often solitary too.
So the feel and look of the lump itself are some of the initial clues, yeah.
Precisely. The texture, the pain, whether it's draining, if there are multiple lesions. These all help narrow it down.
Okay. Any others?
The sources also mention mast cell tumors or epitheliotropic lymphoma. These are types of cancer that can involve the skin and underlying tissue. They often appear as multiple, sometimes red, lesions with a variable feel.
Right. Cancer again.
And this is important. The sources clarify that sterile nodular panniculitis, that idiopathic kind.
The mystery box one.
Yeah, it's often a diagnosis made after ruling out all the other potential causes on this long list. It's the conclusion you reach when you just can't find an infection, an immune disease, cancer, or any of the other known triggers.
It's the diagnosis you arrive at by exclusion. Okay, so what tools does the vet use to start ruling things in or out? What about lab tests? Are they helpful?
Definitely. You usually start with baseline blood work and urine tests, a complete blood count, or CBC, a biochemistry panel, and a urinalysis.
Standard stuff.
Standard stuff, yeah. But the sources note that while panniculitis cases sometimes show no abnormalities on these tests, most steatitis cases and some panniculitis cases will show specific changes that provide clues.
Okay, what kind of changes are we looking for? What gives you clues?
The sources mention findings like increased white blood cells, specifically neutrophils and sometimes eosinophils.
Signs of inflammation.
Right, signs of inflammation or the body fighting something. You might see signs of anemia, low red blood cells, or low protein levels in the blood, specifically hypoalbuminemia, maybe protein spilling into the urine, proteinuria, and possibly low blood calcium, hypocalcemia.
So these give clues about the body's overall inflammatory response and internal state.
Exactly. They help build the picture.
Are there more specific lab tests mentioned for particular suspects on that big list?
Yes, the sources list a few. Things like testing for anti-nuclear antibodies, an ANA test if an immune-mediated condition like lupus is suspected.
For the immune attack scenario.
Right. Analyzing blood proteins, something called serum protein electrophoresis, can sometimes help. And checking levels of pancreatic enzymes like lipase and amylase.
Ah, because of that potential pancreatitis link you mentioned.
Exactly. The sources link some panniculitis cases to possible pancreatitis, so checking those enzymes can be relevant. And of course, for cats, testing for common viruses like FeLV and FIV is often recommended.
Makes sense. Okay, so blood and urine give you systemic clues. What about imaging? Can, seeing inside help? Ultrasound.
The sources do mention imaging, specifically abdominal ultrasound, can be useful in certain situations.
So what might you actually see on ultrasound in these cases?
Well, in some panniculitis cases, the ultrasound might indeed show evidence of pancreatitis, supporting that connection we found in the sources. For steatitis, the ultrasound can actually visualize the fat itself. It might show it looks abnormally mottled or changed in appearance in areas like the abdomen, the groin, or near the liver in the falciform fat.
Wow, you can see the affected fat.
Yeah, and sometimes there's a loss of detail or contrast within the abdominal cavity, suggesting widespread inflammation. So it helps assess the extent and appearance of the affected fat internally.
Fascinating how that layer shows up on imaging. What about procedures directly on the lump itself, like sticking a needle in?
Yes, this is often where the most direct evidence is gathered. You might start with fine needle aspirates or impression smears.
Taking a sample.
Exactly. Sticking a small needle in to get cells, or just touching a microscope slide to a draining area. The sources mention you might see inflammatory cells like neutrophils, other immune cells like macrophages.
What you'd expect with inflammation.
Right. And if it's an infection, you might potentially see the bacteria or fungal organisms right there under the microscope.
And can you test for specific infections from those samples too?
Yes, absolutely. The sources highlight the crucial role of tissue culture. Taking a sample from the lump, either an aspirate or ideally a biopsy piece, and sending it for bacterial culture and sensitivity testing is essential if infection is suspected.
Why sensitivity testing?
That tells you which specific antibiotics will actually kill the bacteria you've found. Super important for effective treatment.
Ah, got it.
Fungal cultures and tests for those opportunistic mycobacteria are also needed depending on what you suspect. And the sources also mention specific tests like urine antigen testing for certain fungal infections, like blastomycosis, which can sometimes cause skin lesions.
So identifying the exact culprit is key for infectious causes. What's considered the gold standard for diagnosis overall, according to the sources, like the definitive test?
The sources are very clear on this. Biopsy.
Taking a piece of the tissue.
Exactly. Looking at the tissue structure under a microscope, histopathology, is required for a definitive diagnosis. It's especially crucial to distinguish between the different types of inflammation and, importantly, to rule out cancer. The sources specifically recommend surgical excisional biopsies, meaning removing the whole lump or a good chunk of it if possible. They say these are generally more informative than just small punch biopsies.
Bigger sample, more info.
Right. And pathologists can use special stains on the biopsy sample to help identify infectious organisms or highlight other specific features mentioned in the sources.
What does the pathologist actually look for under the microscope in that biopsy? What kind of findings confirm the diagnosis?
For panniculitis, they examine the pattern of inflammatory cells infiltrating the fat. It can vary a lot. The sources use terms like granulomatous, pyogranulomatous, suppurative, pus-filled, eosinophilic, necrotizing, showing tissue death, or fibrosing, indicating scarring.
Different patterns of inflammation.
Exactly. They also look for evidence of vasculitis, that inflammation of blood vessels within the fat. For steatitis, the sources describe the characteristic microscopic appearance as lumpy or granular-looking fat, often with a yellowish or orange discoloration that might even be visible grossly without the microscope. It's like seeing the specific type of battle damage at the cellular level. It tells a very detailed story.
It really sounds like it. Okay,
Yeah.
so after going through this pretty extensive diagnostic process and hopefully pinpointing the cause, how do the sources guide treatment? What's the approach?
The absolute key insight from the sources regarding treatment, the main takeaway, is that the approach depends entirely on the identified cause.
Makes sense.
You have to target the specific trigger. There's no one-size-fits-all treatment.
Okay, let's start with that nutritional cause. We talked about the vitamin E deficiency in cats with steatitis. How do you treat that?
Right. For steatitis linked to diet, the dietary management is non-negotiable, according to the sources.
Step one.
Absolutely. Remove fish products, especially oily fish, from the diet completely. Feed a balanced, high-quality, commercially prepared food that is nutritionally complete.
Well,
In severe cases where the animal is really sick and can't or won't eat because of pain or systemic illness,
right, if they feel awful.
the sources mention that providing nutrition through feeding tubes might be necessary. Things like PEG tubes, which go into the stomach, or esophagostomy tubes into the esophagus, to bypass the mouth and ensure they get calories and nutrients.
So fix the diet is step one for nutritional steatitis. What about medication for the other causes, like infections?
If the cause is infectious bacterial, fungal, mycobacterial, the sources state that treatment involves the appropriate medication: antibacterial, antifungal, or antimycobacterial drugs.
Tailored to the bug.
Precisely. Chosen based on those culture and sensitivity results we talked about earlier, you're directly fighting the specific organism identified.
Okay. And for the mystery box category, sterile nodular panniculitis, where you haven't found an infection or another specific trigger, how do you treat that?
Yeah, for the sterile idiopathic cases, treatment is typically focused on systemic treatment targeting the inflammation itself. This often means using corticosteroids, like prednisone.
Steroids. Okay.
The sources provide specific dosage guidelines for dogs and cats to start with, but a critical part of the treatment process, highlighted in the sources, is gradually tapering the dose down as the animal improves.
Tapering is key.
Very key. You don't want to stop suddenly. And some animals, the sources say, may need a low dose long-term as a maintenance treatment to prevent the condition from flaring up again.
Are there other options if steroids maybe aren't suitable or they aren't working well enough on their own?
Yes, the sources mention other immune-suppressing medications can be used, especially in dogs, if corticosteroids are contraindicated for some reason or just aren't sufficient.
Like what?
Drugs like azathioprine or cyclosporine. Again, the sources often give starting doses and emphasize tapering based on the patient's response.
Okay. And vitamin E, you said it was a cause of steatitis, but is it also used as a treatment?
Absolutely. That's another interesting point from the sources. Oral vitamin E is recommended as a therapeutic agent for both sterile nodular panniculitis and steatitis.
Even if it wasn't caused by a deficiency?
Yes, apparently it has antioxidant and potentially anti-inflammatory effects that are beneficial. The sources provide specific dosage recommendations based on the animal's weight, usually given twice a day.
Interesting. So it's both a potential deficiency and part of the treatment plan. What else for steatitis specifically besides diet and vitamin E?
For steatitis, the sources also suggest using corticosteroids, but often at an anti-inflammatory dose rather than the higher immune suppressive doses, in addition to the dietary changes and vitamin E.
Okay.
And another medication mentioned specifically for steatitis is S-adenosylmethionine, or SAMe, which is given orally on an empty stomach. It's thought to have some liver-supportive and antioxidant properties.
Right, same. Okay, so once a diagnosis is made and treatment starts, is there a specific follow-up process described in the sources? How do you monitor things?
The sources briefly touch on following up. It's not super detailed, but the main point is that the nature and frequency of monitoring really depend entirely on the underlying cause that was identified and how long the animal needs to be on medication.
Makes sense, it varies.
Exactly. What kind of monitoring might be needed depends on the treatment.
So what kind of monitoring might be needed, for example?
Well, if the animal is on those immune suppressive agents like azathioprine or cyclosporine, or on long-term corticosteroids,
Right, the stronger meds.
the sources specifically recommend monitoring blood work periodically, checking things like the complete blood count, platelet count, and chemistry profiles to watch for potential side effects on the bone marrow or organs.
Okay.
Urinalysis and potentially urine cultures might also be needed, particularly with long-term steroid use, because they can increase the risk of urinary tract infection.
That's that point.
So the goal is really twofold. Ensure the treatment is actually working to resolve the panniculitis or steatitis, and make sure the animal isn't developing complications from the treatment itself.
Got it. So this deep dive, drawing directly from the source material you provided, has really taken us on quite a journey from that initial moment of just feeling an unexpected lump under the skin,
Yeah.
through this incredible range of potential causes for fat inflammation infections, immune system gone awry, diet, trauma, even distant cancers.
Yeah,
Wow.
it's a lot.
We've walked through the systematic detective work, the physical exam clues, the lab tests, imaging, cultures, and ultimately that crucial biopsy to get to a specific diagnosis. And finally, we've seen how treatment is so critically dependent on finding that root cause. It's not simple.
No, it truly highlights how a seemingly simple clinical sign, just a lump, can be the visible tip of a massive iceberg. It can represent a huge variety of underlying biological processes happening beneath the surface.
It really does. And here's maybe a final thought for you, our listener, to consider based on everything we've explored in these sources today.
Yeah.
How does the body's fatty tissue, which we often think of simply as padding or maybe energy storage,
Yeah.
how does it become this potential battlefield? A site for such a vast and varied array of insults, from tiny microbes and immune system glitches to nutritional imbalances, physical injury, and even signals from a diseased organ like the pancreas. What does this tell us about just how interconnected and complex, seemingly disparate body systems truly are?
It definitely makes you step back and appreciate the intricate diagnostic puzzle vets face every day, and just how much information and careful investigation is needed to solve what, at first glance, might just look like a simple lump under the skin.